Hello everyone, here I'm back with a video lecture and today we are going to discuss the types of range of motion exercises. In the last lecture we have discussed the basically introduction of the range of motion. So now basically range of motion or the types of range of motion is plays a crucial role in rehabilitation and movement therapy. That means it helps us determine the appropriate intervention based on patient's physical condition and the functional abilities. So you can design easily the appropriate intervention or treatment plan. Okay. So there are three types as we have discussed: passive range of motion, active range of motion, and active assisted range of motion. Passive range of motion refers to the movement of a body segment within its unrestricted range of motion, produced entirely by an external force with little to no voluntary muscle contraction. That means if you can perform this passive range of motion, that is basically performed by a external force. That external force basically the sources are majorly the machines, the therapist, or another body part of the same individual or the same person. So with that, gravity itself is an external force. So all of these are the things that are involved in the sources of the external force. So passive range of motion is basically when you can perform a movement, a range of motion to the certain level where there are no restriction or unrestricted range of motion. It is completely performed by a therapist or a patient itself or a machine. Patient cannot move its extremities. Okay, you can say that patient cannot move its own limb. You can perform these movements. Okay, the flexion, the extension, abduction, adduction, or patient's muscle contraction is basically no itself. Okay, involuntary is present some kind of, but voluntary is no. Completely little to no as muscle contraction is present. Okay, so that means it is completely in the hand of the um, passive work or external force, not on in the involvement of any of the internal feature of itself or the body itself. Okay, so the key consideration is basically here the passive range of motion is different from the passive stretching. Remember that. Okay, stretching is something else as we have discussed before. So you cannot elongate a muscle, you can just limit that passive range of motion to a certain unrestricted range of motion level. You cannot further elongate or stretch the muscle, or you can just lengthen the muscle because you want that early gripping of the patient, or you can early recovery of the patient. You cannot work on that in these situations. You can just work in certain conditions that passive range of motion is different, or you can just say that the passive range of motion is different from the passive stretching, because passive range of motion maintains the movement. It doesn't increase the movement or increase the flexibility. It works on the maintenance, not on the increasing, or you can say that the increasing the flexibility. Okay, that is something else we can discuss in the chapter number 4, the stretching chapter. Okay, so passive stretching is something else as we have discussed. So used when a patient cannot actively move. Okay, passive range of motion is performed when patient cannot actively move the joint due to conditions like paralysis, the coma, severe pain, stroke like conditions, weaknesses, etc. These are the conditions where patient cannot move its limbs. So you can just perform with the any of the sources that we have discussed before. Okay, active range of motion is basically a movement of a body segment within its unrestricted range of motion produced by the active contraction of muscle crossing the joint. That means here the patient can voluntary muscle contract itself. They can work, they can contract the muscles, they can move the extremities on their own. So that basically means that a patient can actively perform their movement. That if you can ask the patient to flex, they can flex their arm. If you can ask the patient to extend, they can extend their arm. So you can ask the patient, or you can just demonstrate that this is how you can perform this. Is all like when there is an active contraction, so that means the active range of motion is performing. That means patient can itself perform, actively perform any of the activity. So that means the active range of motion is performed. Okay, so it is basically helps in maintaining the muscle strength, joint mobility, and the circulation. So it is used in the patients who can contract the muscle itself. They don't need any of the assistance or any of the need of the were to performing any specific activities. Sometimes after the surgery or injury, there are certain patients who can perform the active range of motion on the other limbs other than if some kind of activity is present in the upper extremities, or you can say any surgical procedure is performed on the uh, cardiac region, or you can say that the upper limbs. So patient can easily perform the lower limb activities. There doesn't need any kind of assistance during performing that activities of the lower limb. So that means everything is depending on the patient itself as well. Some kind of some patients are very active as compared to the others, so they can perform active exercises as an stage rehabilitation after an injury or surgery. So it basically helps in early stage rehabilitation very well if patient can perform actively. So after that, active assisted range of motion is basically when patient needs an external assistance while performing an active range of motion. That means patient can perform, like as you know that shoulder flexion is 160 to 180-degree normal. Okay, patient can perform easily by to 120 degree, but after that he needs an external assistance. So you can provide that with the manual or mechanical device because the prime mover muscles need help to complete that motion. So you can just assist them with some kind of external assistance, like therapist assisting the movement, patient using their opposite limb to assist, or any mechanical aids like water resistance, elastic bands, pulleys, any kind of. Okay, so you can just give a patient some kind of assistance to perform the complete active range of motion is basically called as active assisted range of motion. It is used in basically patients with muscle weakness because due to weakness, patient cannot completely complete its range of motion that patient has to due to any injury, stroke, or neurological condition. So you can just assist them with that certain conditions so patient can perform that. Okay. So like it is basically the mid range of the stepping stone of the towards the full complete active range of motion. Okay, so you can say that it is basically patient can stepping stones towards the full active range of motion. Okay, so passive range of motion, as we have discussed today, and there are three types: passive range of motion, completely passive, with movement provided by an external force. Active range of motion is actively controlled by patient's own muscle. Active assisted is a combination of both, where external help is given when needed. Okay, patient can perform actively, but if there is any requirement of the external assistance, you can just provide it basically. These techniques are crucial in rehabilitation to maintain joint mobility itself, prevent stiffness, and aid in recovery. So, help in recovery process. So, this is all about today's lecture. Thanks for watching. If you have any queries, you can ask in the comment section, and any recommendation you can ask. Thanks for